Healthcare is the topic of much debate and an issue that is important to me. The debate over universal healthcare has seemingly been ongoing for my entire life, with very little movement. The debate usually centers on the American private health insurance system versus a universal government healthcare system that is commonly used in many other countries. This debate is so often caught up in anecdotes, fear-mongering, and partisan politics that the facts and measurable statistics are often left out. The truth is that a universal healthcare system would reduce medical costs, help the economy, and improve healthcare quality as it has in many other countries. And here's why. Universal healthcare is less expensive than private insurance. When comparing the United States to other comparable nations with universal healthcare systems, the US consistently ranks at the top in terms of healthcare spending. The United States spends an average of $10,966 per capita on healthcare annually. Other comparable countries spend an average of $5,697. This is obviously a drastic difference, and for this added cost to be worth it, our healthcare quality would have to be far better than other countries. Unfortunately, it is not. The US consistently ranks at the bottom in terms of medical outcomes and life expectancy when put up against other comparable nations. In 2020, life expectancy in the United States was 77.3 years. In comparable countries, the average life expectancy was 82.1 years. All of the comparable countries used in this comparison have some form of universal healthcare. Similarly, the mortality rate, or the number of deaths per 100,000 people, has been falling slower in the United States than in the same comparable countries. In the United States, it fell by 29% from 1980 to 2017, while in other comparable countries, it fell by 43% over the same period. Universal healthcare will also remove the economic burden of going to the doctor and encourage Americans to get regular checkups. 22% of Americans say they have avoided going to the doctor because of the cost. A universal healthcare system will improve care by ensuring that people can go to the doctor and get the appropriate medical treatment without worrying about the cost. This will improve people's health and reduce costs over time by catching potentially dangerous conditions earlier. A universal healthcare system will also provide a boost to the economy. Under our current system, most people receive health insurance through their employer, but this can make people more hesitant to switch jobs or start their own business out of fear of losing their healthcare. Removing the connection between employment and healthcare will increase worker mobility, freeing up people to look for better jobs or to create their own businesses without the threat of losing their health coverage. Removing the burden of providing healthcare to their employees will also boost small businesses and make them better able to compete against large corporations when looking for employees. An already established and successful company has the funds to offer high-quality healthcare, while a startup struggling to get off the ground has more limited resources. A common argument from opponents to universal healthcare is the appeal for the free market. They argue that government involvement in the healthcare industry is at fault for increasing prices and that the free market is the best solution. But they fail to take into account the quality of medical care and how other countries actually fare with more government involvement. Countries with more government involvement have lower costs and better quality care than the United States. And this argument for the free market is also flawed. The free market works great for goods that are in perfect competition, meaning that all versions of the product are identical and the consumer is free to choose the lowest cost option. But with something like medical care, where the quality of service can differ greatly and where the quality can mean the difference between life and death for the consumer, people are willing to pay whatever they need to get the best care possible. This makes the demand for healthcare very inelastic, meaning the demand does not decrease or increase with changes to price. Because of this inelastic demand, the providers can massively increase prices and people will still pay it, even if it means crushing debt for them, leading to the current issue of low quality care for ridiculous prices. Under a universal healthcare system, people wouldn't have to worry about the cost of their healthcare. They could get the best care they can find, making the market more about quality of care rather than cost, encouraging hospitals and doctors to improve their care instead of cutting costs. And even so, other countries show us that costs will still likely come down anyway. Another common argument from opponents to universal healthcare is the myth that countries that have universal healthcare make their patients wait months to get any treatment. This is false. The United States ranks as one of the worst countries in terms of average wait time for a primary care physician, and even though the US does rank better on wait time for a specialist, it's still behind Switzerland, Germany, and the Netherlands, who all have universal healthcare systems. Universal healthcare would improve the medical system in the US in a variety of ways. It will decrease healthcare costs, boost the economy, and increase quality of care across the board. The only things standing in the way of universal healthcare are misinformation and lobbyists from the insurance industry looking after their own interests instead of the average person.